Did you know that nearly 1 billion people worldwide have low vitamin D levels? That's a staggering number. And while most people think vitamin D is only about strong bones, it actually affects so much more, including your mood, your immune system, and even your heart and muscles. Today, we're going to explore everything you need to know about vitamin D, what it does, why doctors recommend it, the benefits, possible side effects, how dose matters, and how to use it safely. Whether you're thinking about starting supplements or just curious about this sunshine vitamin, here's what you need to know. Let's dive in. Vitamin D isn't like other vitamins. While we get many vitamins from the foods we eat, vitamin D is unique because your body can actually make it when sunlight hits your skin. When ultraviolet B, UVB, rays touch your skin, a chemical reaction occurs, producing vitamin D3, which is then converted into an active form your body can use. That's why it's sometimes called the sunshine vitamin. Doctors prescribe vitamin D supplements primarily when someone isn't getting enough from sunlight or diet alone. Low vitamin D levels can lead to weak bones, fatigue, frequent illness, and even mood changes. People who live in areas with little sun, work indoors, have darker skin, or are older often need supplements. But before taking any vitamin D, it's important to understand both the benefits and the risks. One of the biggest benefits of vitamin D is its role in bone health. Vitamin D helps your body absorb calcium, which is essential for building and maintaining strong bones. Without enough vitamin D, calcium can't be absorbed efficiently, and this can lead to conditions like rickets in children or osteomalacia in adults, which cause soft or weak bones. In older adults, low vitamin D levels increase the risk of osteoporosis, where bones become fragile and more prone to fractures. This is why doctors often recommend vitamin D alongside calcium supplements, especially for postmenopausal women or people at higher risk of bone problems. Vitamin D also plays a key role in supporting your immune system. Research shows that people with low vitamin D levels tend to get sick more often, including colds, flu, and other infections. Vitamin D helps activate certain immune cells that fight bacteria and viruses. While it's not a cure for illnesses, keeping your vitamin D levels in a healthy range can help your body respond more effectively to infections. During the winter months, when sunlight is limited, supplementing vitamin D can be especially helpful in maintaining immunity. Another interesting effect of vitamin D is its impact on mood. Some studies suggest that low vitamin D levels are linked to low mood or mild depression, sometimes called seasonal affective disorder, SAD. This may be one reason people feel more tired, sluggish, or down during winter months. While vitamin D is not a replacement for professional therapy or medications for depression, having adequate levels may provide some support for mood regulation and overall mental well-being. Vitamin D is also important for heart and muscle health. It helps your muscles contract properly, which is essential for movement, balance, and strength. Without enough vitamin D, you may feel weak or have muscle aches. Some research also suggests that adequate vitamin D levels may support cardiovascular health, although more studies are needed to confirm this fully. Nonetheless, keeping vitamin D within a healthy range is a simple step toward maintaining overall physical health. Like any supplement or medication, vitamin D has potential side effects, especially if taken in excessive doses. Too much vitamin D can lead to toxicity, a condition called hypervitaminosis D. Symptoms may include nausea, vomiting, weakness, frequent urination, and even kidney problems. This usually happens only when people take extremely high doses, far beyond the recommended daily allowance for a long period of time. That's why it's so important to follow your doctor's instructions and not self-prescribe large doses. Your blood levels can be tested to determine exactly how much vitamin D you need. Vitamin D can also interact with other medications. For example, steroid medications, weight loss drugs, certain heart medications, and some seizure medications can affect how vitamin D is absorbed or processed in the body. Heavy alcohol use may also interfere with vitamin D metabolism. This is why it's crucial to tell your doctor about all medications and supplements you're taking before starting vitamin D supplementation. Your individual health status, such as kidney or liver conditions, can also influence how much vitamin D is safe for you. So, how do low and high doses of vitamin D compare? A typical daily dose for adults is around 400-600 IU, international units, which is generally safe for most people. Doctors may prescribe higher doses, sometimes up to 4,000 IU per day or more, for people with significant deficiencies. Low doses help maintain healthy blood levels, support immunity, and keep bones strong. High doses, when medically supervised, can correct deficiencies more quickly, but taking very high amounts without monitoring can be harmful. Over time, excess vitamin D can cause calcium to build up in your blood and tissues, leading to kidney stones or even heart problems. This is why testing blood levels is a safe way to know your personal needs. One important thing to note is that vitamin D does not cause dependence or withdrawal like some medications do. You won't get addicted or experience cravings if you stop taking it. However, if you stop taking it when your body actually needs it, your levels can drop again, leading to fatigue, weak bones, and other issues over time. So consistency is key if your doctor recommends supplementation. Taking vitamin D regularly, either through sunlight, diet, or supplements, ensures your body maintains the levels it needs for optimal health. Safety tips are essential when taking vitamin D. Avoid megadoses unless prescribed by a healthcare professional. Monitor your intake from fortified foods, multivitamins, and supplements to avoid accidentally taking too much. People with kidney disease, liver disease, or certain metabolic conditions should be extra cautious. Be aware of potential interactions with medications and always consult your doctor before starting supplementation. For most people, moderate daily doses combined with some sunlight exposure and a balanced diet provide the best results. In summary, vitamin D is much more than a bone vitamin. It supports immunity, mood, muscle function, and overall well-being. Low levels can lead to fatigue, weak bones, and increased illness risk, while very high doses can be harmful. The right dose varies depending on your age, health conditions, and lifestyle. Always check with your doctor before starting supplements, monitor your levels if needed, and aim for a consistent, safe intake. Remember, vitamin D can be found in sunlight, certain foods like fatty fish and fortified dairy, and supplements when necessary. Consistency and balance are the keys to benefiting from this vital nutrient. So, next time you're enjoying a sunny day or adding salmon or fortified milk to your diet, know that you're helping your body in ways you might not even realize. Keep an eye on your vitamin D levels, take supplements responsibly, and enjoy the health benefits this amazing vitamin has to offer. If you found this video helpful, like, comment, and subscribe for more easy-to-understand health tips. And I want to hear from you. Do you make sure you get enough vitamin D every day? Drop it in the comments.